You see people at their low, their families, their children, when they have no hope left, and I get to come in and give them hope. So what wishes do for me is it allows me to get up every morning to go there and give something back to those families that I otherwise could never give them, that I'll never, ever, ever give them, and they get the power of hope.
My name is Anup Patel. I am the section chief of neurology for Nationwide Children's, and I'm also an associate professor at Ohio State University in neurology and pediatrics. One of my greatest experiences in the WISH program was a young man, teenager named Deshaun, and he had really bad epilepsy, and it was really more difficult for Deshaun and his family because he actually grew up for several years being completely normal. I remember reading his EEG or brainwave exam. That's one of the things I do, and I remember looking at that, and I sat back, and at the time he was being followed by one of my colleagues, and I said to her, I said, Dr. Jones, I said, this child is going to be sick. And he's going to get worse, and you need to be ready, and you need to prepare his family. And sure enough, unfortunately, I was right. I wish I wasn't, but I knew at that time I was going to be. So she decided to transfer his care to me just because of my specialty. And it was tough. I got to know him and his family, and we didn't have a lot to offer. And it was right around that time where we had this presentation from the Make-A-Wish folks. I feel that was an opportunity that I was able to give that I might have missed had I not been exposed to the Make-A-Wish program. And when I did, I didn't really know what to expect. I again wanted to give them a break from this illness. That's one of the great things that we see in the WISH kids is they get to kind of hit the pause button on whatever is making them sick and again get to experience something with their family and give back. And so we did. We sent him on his trip, which was to meet his idol, Chris Paul, who at that time played for the LA Clippers. But the WISH program did something even better. They just totally took the experience and treated him and his family like VIPs or very important people. He went to see Chris Paul and Blake Griffin and the rest of the Clippers, got to work out and warm up with them. It was pretty amazing. We got to see some video and pictures of it. But then they also got to go to Universal Studios. He had some younger siblings who really liked amusement parks, and so they kept saying, Deshaun, you gave this to me, you let me do this, thank you, thank you, thank you, you're such a great big brother. And you have to remember, at that time, Deshaun couldn't be a big brother. And I'll try not to get too choked up, but he couldn't be their role model. He couldn't be their big brother. He was sick. And then he was able to do that, and it just changed him completely. So I saw him shortly after he came back, and he went there with seizures, as we thought and knew. Tried to change his treatments, and understandably, we knew he was still going to have daily and weekly seizures. But then he came back, and I said, how's it going? How's your trip? And he lit up and was so excited and shared these stories, brought a picture back that I framed. And he then said, well, I haven't had a seizure since I left, or, for the trip. I said, excuse me? And I looked at his mom and I said, is that true? And she's like, couldn't wait to tell you. He had not had a seizure. That was over 3 years ago, and he has still had no seizures since then. And I thought that was the most amazing thing. And I couldn't understand why that happened. I mean, I really didn't do anything special. I couldn't take credit. I didn't change his medicines in a way that I thought would work. And if they did, they would have worked before he left for his trip, because I really tried to get him seizure-free so he could experience a better WISH experience. It wasn't me. It was something else. And then I saw it over and over with these other kids. And I kept thinking to myself, what is going on that you could give something this simple but have such a great impact? I thought it would be something in a short term where I could give them that pause button, they can enjoy their time with their family and take a break from their illness, but then everything would start back up. I wasn't seeing that. I thought kids were getting better, they were staying better. And so we decided that it was time to really look into it. As part of the job I do here is I do a lot of research, and I love clinical research because it gives me an opportunity to kind of figure out questions and answer them for people. So I said to myself and team, I said, let's look at this. Maybe there's something more than just my experiences, my one-off examples of these kids getting better. As I started to talk to other people, they experienced similar things, that these kids seem to be better. And I thought, well, let's see if science can help explain what happens when you have a WISH experience. Perhaps there's something more that's long-lasting in these kids and their families that we could collect. And what we did was we took a group of kids, we took all the wish kids who got wishes here at Nationwide Children's Hospital in the last 5 years, and we took their illnesses and looked at how old they were, what kind of illnesses they had, what kind of other what we call comorbidities, or company that it keeps kind of illnesses that go along with having a primary illness. And we tried to match those kids to similar kids that were like them, but the only really major difference was, for whatever reason, they didn't get a wish. What we found was that the kids with wishes compared to those that didn't get wishes, had a lot less likelihood of going to the emergency department, getting hospitalized, utilizing healthcare research or resources, a lot less than those kids who didn't get the wish. And so we found for the first time that basically after a wish, you save healthcare dollars, that these kids are healthier, that they are doing better, therefore they're not in need of going to the emergency department or being hospitalized again or utilizing a lot of resources compared to those kids who didn't. And I found that to be amazing because it really highlighted what we saw in our experiences, but now crystallized it for the first time, that showed there is a return on investment from a wish experience. That not only are you giving a child and their family hope, not only are you giving your child and family a break from their illness, not only are you giving a child and their family an opportunity to give back to their siblings and to their other loved ones, you're giving them an opportunity to save healthcare dollars. You're giving them an opportunity to not come back to the hospital, to spend time with their family where they belong when they're sick and have an illness. Honestly, one of the major reasons why I want to get this research published and out there and do other research is to help people and other medical providers understand what I've seen and understand that it absolutely has to be a part of that treatment plan. A wish is more than just a nice thing to do, that you are going to help their care. You're going to help them get better. And now I'm passionate to make sure that every kid out there gets a wish. We found lots of kids in our own hospital that didn't get the wish experience, and I don't know if their care would have gotten better. I don't know if that would have changed who they were or what they were. I think about that every day, and I wish we could go back to those kids and give that to them. And I now have a mission, I have a goal that I've got to provide every eligible kid a wish. I have to, because I can give something that's so important to them in their life, that is more than just a nice thing to do. That's something that will live with them for the entire life and help their health get better. And if that's my goal as a physician, is to help my children get better and be cured, or at least lessen the burden of their illness, then darn it, I have to do that. But I can't do it without donations. I can't do it without the money that's given to the organization. I can't do it without the ability and the funding to provide a wish. You can change a life for the rest of their life. You can improve the quality of their life. You can transform their health care by giving, by donating, by providing a resource that otherwise we wouldn't have. That's what you can do. You can do it today, you could do it tomorrow, but more importantly, you're going to change a life forever.